Do you have weakness in your finger extensors and your wrist extensors so that you can't resist pushing down on your fingers or on your wrist? Or do you have tricep weakness? If you have these symptoms, this could be radial nerve entrapment. We've done a video on carpal tunnel, we've done a video on ulnar nerve. Today we'll cover radial nerve. And the radial nerve leaves, like the others, leaves from the neck, heads down the shoulder and arm through the triangular space made by the tricep and the teres major, travels along the radial groove on the back of the humerus, passes through the supinator tunnel here, and to the back or dorsum of the hand. So if you're having weakness in your extensors, or you're having sensory issues on the back of the hand, numbness, tingling, the like, then you may have radial nerve entrapment. So we want to determine where is the entrapment or where are the entrapments, because you could have what's called double crush syndrome, where there's multiple entrapments along the chain. So we want to trace the course of the nerve. The nerve leaves the neck. So in leaving the neck, it's passing through soft tissue and musculature there. So we want to evaluate cervical paraspinals and make sure the tone there is normal. Then we want to look at the triangular space, which is made by the medial tricep and the teres major. The nerve passes through there. So any tension through those muscles or adaptive shortening facilitation could excuse me, entrap that nerve and cause symptoms like weak tricep, weak extensors, numbness and tingling down the arm. If we're talking about the radial groove, where it passes on the back of the humerus, this is an area commonly affected by trauma. So if you fall and break your arm and all of a sudden have wrist drop and numbness and tingling, then the nerve literally is attached to the periosteum, to the bone. So if you fracture your humerus the unlucky way, you may impact that nerve and lose everything downstream. So radial groove is the second entrapment point. Third is through the supinator tunnel here. So if we have supinator tunnel entrapment, it looks a lot like radial groove. You still have the wrist drop and finger drop, but the difference is sensory will be spared. So if you can still feel everything, but you have the weakness, it's probably supinator tunnel. Whereas if you have numbness and tingling, the sensation is off, and you have the weakness, that's probably radial groove. So just like the other nerves we've discussed previously, if you're having signs and symptoms of radial nerve entrapment, you want to assess or work with a doctor to make sure they're assessing every possible entrapment site for entrapment and treating accordingly.